Okay, and here's the last comprehensive case that we'll get in. We'll go over until we get into some of the other uses that I like to use uDesign for. So this is Cedric, came in, a pastor, and so he wanted to get some work done, but he didn't want to have to be in the pulpit with braces on, which is understandable. And so he wanted to fix his bike, and but he wanted to do it with aligners. And so this is the upper and lower, and you can look at that lower right 3 and the cross bite that is in. We're missing the lower right 6. The occlusion though is in a really good spot, so I'm happy with that. And then we have some mount crowding in the upper. When I look at the lower, we start to see there's a lot more that's going on, and so this lower left 3 is essentially blocked out of the arch. And then we also have some other crowding that's going on between the lower incisors as well. And then because of the blocked out canine, you can see that the midlines are not coordinated because things have kind of shifted over to the left because of that blocked out lower left 3. All right, here is his pan and ceph. Nothing, again, remarkable here. You can just see the missing lower right 6. The wisdom teeth are extracted. The angulation of his teeth are acceptable. And so the treatment plan for him is we want to extract the lower left 2. And the decision, the way I look at it is because the lower incisors always make me a little queasy. And I'm always concerned about having, excess overjet at the end of it, especially when we're not extracting anything in the upper arch. But one, I was able to do a simulation with the lateral in and also simulation with the lateral extracted, which is, a good service that we can have because within the uDesign platform, you can do multiple treatment plans to see which one you like best. But I looked at his overjet as it is now. I looked at his bite. I was happy with all of that. And when I did the setup to line those teeth up, even with a lot of IPR, it was, going into a class 3 edge bite, which I didn't like. When I did the setup with the extraction, because of the other crowding that he had with the lower 2 to 2, it was almost like a, take it out and swap it in. So I felt comfortable that I was not going to leave him with a lot of excess overjet. And so basically we're going to maintain that space in the lower right and extract the lower left 2 and align the upper and lower arches. And so this is his setup. And again, here's one where he had 10 aligners up top, 28 in the lower. So I'm not going to match that up and do 28 in the lower when it just didn't need it. But you can see, we wanted to rotate the tooth into position and then I extruded. So I broke up the movements. The first part, again, is the rotation. And then I started to extrude it instead of trying to do it all at once. And then again, just lined up the rest of the lower 3 incisors and some of the posterior teeth just to get everything nice and lined up. And then in the upper, again, not a whole lot going on. That upper left 2 needed some work. And so we just kind of wanted to line everything up and get it nice and spiffy. So just kind of lining those laterals up, and you can see the occlusion in the setup is acceptable, at least to me it is. And so I was happy with this option. And I have 2 different attachments on the lower left 3. So I have one that's going to help translate the tooth and move the root. And then I have the one above it to help with extruding it. And so I wanted to make sure, and fortunately he had a lot of anatomy on that canine that I was able to do that. But you want to be able to leave some space in between those attachments so that the aligner can get in between so that you can really take advantage of it. But again, being able to stage movements, the first part was, lining everything up and just kind of rotating the canine, and then started to extrude it to get it where I needed to go. And so for him, the first 10, I don't know, I can't remember what was going on in the office at the time, but I actually sent the first 10 out to the Memphis facility with uLab. So they fabricated his first 10, and then we made the rest of his lower aligners. And so this is where he finished after 10 uppers and 28 lowers. And again, at the end of the 10th upper aligner, we gave him a retainer just to kind of maintain and hold things as we continue to line things up in the lower. And typically what I'll do, especially when we have this amount of discrepancy between the upper and lower arches, we told him just to go nighttime only with the retainer in the upper. And so he didn't have to worry about it during the daytime, just popping in at nighttime before bed as we, again, continue to work with the lower arch. So some of the refinement goes, one, I didn't like the vertical position of the 3. I think the alignment of it was pretty good, but we didn't do a really good job of extruding it. And then also, there's a little more overjet than I liked when I looked at it in real life and how the case actually treated out. And so I wanted to, do a little IPR on the upper just to kind of reduce that overjet a little bit more. But overall, he was super thrilled with where he was at this point, as was I. And, I felt like, we had a good opportunity to bring it on home. So this is his refinement setup. So I took off that upper attachment and just left the vertical one to help with the movement. And again, I did a lot of the movement and then I extruded it again, the importance of the stage treatment. But I also added an attachment to the lingual. And again, for me, and I'll just go back real quick here, I like to have the bevel going incisely, because again, when I'm looking at this aligner, it is going to, as we move through the aligners, go higher and higher. And I just need a nice ledge for that aligner to just get caught underneath so I can have a good handle as I'm trying to extrude those teeth. And so again, the first half was just kind of getting the root movement a little bit better. Second half was extruding it. And then up top, I just wanted to again, tuck things in a little bit more, kind of align the upper 2 to 2 a little bit better. And then, this is the final setup. Added some attachments to his maxillary laterals and we're good to go. And so this just illustrates, kind of how I'm using the attachments. And again, a very simplistic, almost caveman way of thinking about it. And that's just the way my brain works. And so, you can incorporate a ton of different biomechanics and all this stuff within it. But for me, I just like to look at it from a very simple, simplistic standpoint. And, to move a tooth, you need to have the displacement in the aligner, and the aligner needs something to attach to get the movement. And so you can see there's a nice surface on the distal half of that attachment to help with the root movement. And then we have that nice undercut that's created by that attachment to help with the extrusion of that canine. So this is where he finished. And so again, the occlusion is still nice. We were able to extrude that canine and line things up a little bit better. And then this is just a comparison from where we finished with the first set to where we finished with the refinement. So again, if you look at the vertical position of that lower left 3 in that upper left picture and how we were able to extrude it, again, very simplistic way. So I didn't have to tip it out, bring it up, any of that. I just made sure there was no collisions, there was no overlap of the teeth, and I gave the aligner something to grip onto to help with the extrusion. And then also you can see the overjet correction that I had by, I think I did a little hand stripping up top and just tucked those upper incisors back a little bit just to give us a little better coupling in the anterior. So the goals were achieved. Again, patient happy, I'm happy. And I think we were able to give him a good result. And then this is the final pan. And you can see the root of that lower left 3 is in a good position. So we didn't just tip the canine into the space. It's in a very good position. And this is the final step showing the good anterior coupling. So again, not excessive overjet. We have it right, where it needed to be. And then this is his case summary. So again, the initial set in the upper was 10, the lower was 28. We gave him a retainer to maintain as he finished out the lower. The second set was upper and lower 10. For all the aligners we used Endura Flex, 10-day changes. Total treatment time was 12 months. And so again, when you look at the efficiency, it's hard to beat with aligners because you just let them work. And I think we saw him maybe 5 times throughout the whole year of treatment. and to get the results that we got, I was, extremely thrilled about it. Now, it did require a very compliant patient, which he was, because it's very easy to have, teeth that needed that much rotation as that lower left 3, to have that much root movement to happen. With bad wear, we would have got a ton of dumping along the way. So he was a great patient. He was motivated, and with a great setup and a great patient, we can get where we need to be.